The Native Hawaiian Health Scholarship helped me and my family get me through schooling, get me licensed, start my career, and start helping, our Native Hawaiian population without that huge financial burden of student loans. I found my interest in healthcare through my involvement with the Boy Scouts and learning about first aid and how to help people. I then went to BOE Hawaii and I majored in history and Hawaiian studies, and that kind of solidified my interest in taking care of our people. I really got to see firsthand healthcare in this small rural hospital in Wahiawa. I really wanted to work with patients before they kind of got to that point of needing emergency services. And so that pushed me to look into school options here in Hawaii to obtain a level of primary care certification. How I ended up here on the island of Lanai is school asked if any of us were interested in doing a clinical rotation here at Lanai Community Health Center. And growing up, my uncle's close friend was from Lanai. We would come over to fish and camp. So I ended up coming here in the last clinical rotation of my family nurse practitioner degree. When I first started working in healthcare, I did not have an idea that I would be involved in like an administrative and leadership role. And that kind of progressed through my time here at the health center. And now, I oversee the day-to-day operations for the medical department here at the health center and providing primary care services. Being a family nurse practitioner, I have the opportunity and blessing to see families. And I really value watching my patients grow, to see them for their sports physicals or their annual physicals. I always ask them, so what's the plan? What are you going to do after high school? And I really encourage them to consider the health field as a career option and the importance that it has taking care of the people that they serve, and then also providing them with a stable career very much needed, in our islands here. Our community is generally within 5 minutes of the clinic. So as far as access, there is no traffic. We do have the ability to offer transportation for our patients who don't drive. We can pick them up and bring them here to the clinic. And so I really see the benefit that has by being so close, to our patients' homes, and then also close to the school that, children can come with their parents and get care here at the health center very easily. The Native Hawaiian Health Scholarship also helped connect me to other Native Hawaiian health practitioners who had the same mindset and goals of staying here in Hawaii and serving our people. One challenge that Native Hawaiians here on Lanai face is access to care. The access to an operating room here on Lanai, the access to specialty care that is readily available on the other islands. And that's one thing that I really value with my work here at the health center, is we really build a robust tele-specialty program that's founded and based in primary care, where myself, the primary care provider, is at the at the hub of the telehealth program. And I'm not just, sending my patient off to a specialist and, waiting for a consult to come back. I'm actually in the room with the specialist, with my patient, through telemedicine, connecting everybody and reducing the need to put my patient on a plane, fly them to Oahu, and deal with the challenges that come with, having to leave the island to get medical care and then to come back. I really feel that having Native Hawaiian health providers on every island is important for those Hawaiians who live there. And I'm very fortunate to have that scholarship help me to achieve my goal of becoming a family nurse practitioner and a primary care provider.